Some Canadians still wondering as we begin this week whether the AstraZeneca vaccine is the safest option. There have been more countries suspend their use of AstraZeneca because of reports of blood clots. Health Canada out with guidance maintaining the vaccine is safe, and Laura McQuillan has in fact an update from Health Canada and from the company itself. Laura.
That's right, Heather. We got a statement yesterday from AstraZeneca, and they say they've looked back at millions of vaccinations given out with its vaccine in Europe and in the UK, and that there's no evidence of an increased risk of blood clots or of bleeding, like those cases that have been reported in Denmark and Norway, which have led several European countries, including Ireland on the weekend, to suspend the use of this vaccine. So there has been some concern around the world about what is going on here, but AstraZeneca saying it has taken a deep look at vaccinations, and in the statement they had a comment from their chief medical officer who said around 17 million people in the UK and EU have now received their vaccine. The number of cases of blood clots reported in the group is lower than you would expect among the general population. They went on to say that there are no confirmed issues related to any batch of the vaccine used in Europe or in the rest of the world, but they are keeping an eye on that and doing more retesting, Heather.
And in Quebec, what we're hearing, Laura, is some Quebecers are refusing to get the AstraZeneca vaccine. Now, what is happening in that situation? Yeah, so there it's been used in some clinics, a bit different to other parts of the country, which are focusing on pharmacies. But in Quebec, what we're hearing is some people who go into these clinics and hear they're getting the AstraZeneca vaccine saying they don't want to get that one. And it is for a couple of reasons. They're saying, including because of these blood clotting reports coming out of Europe, which they do have some concern about. So over the weekend, we turned, as we often do, to infectious disease specialist Dr. Isaac Bogosh to get his take on that. What he said is you need to look at these incidents of blood clots in the context of what is happening overall. You need to look at the general population, as AstraZeneca says it has done, and then assess what the risk might be. I'll let him say it in his own words.
Clearly needs investigation. I think because it is so incredibly rare, and because it hasn't really definitively been associated with the vaccine, it's acceptable to keep an open mind. But I like the Canadian approach, which is let's keep using this for now. Of course, we keep an eye on it. We have to timestamp all of our conversations. But if there's more data that suggests that there's an issue, we can always pivot. But that data doesn't exist just yet. So I'd carry on with this for now.
And what Health Canada has said on that front is that there haven't been any adverse events like this in Canada, and that it's keeping an eye on information coming out of Europe as those European regulators check back on vaccinations, check to see whether there are more cases or whether they are even linked to the vaccine in the first place before deciding whether to take action here. Some of the hesitancy we're also hearing is about the efficacy, because this is a vaccine where we've heard that 62% figure, and doctors like Dr. Bogosh telling us that it might be lower than some other vaccines, but it is still incredibly high. That's why it's been approved in Canada. And on that approval front, one more note, Heather, it has been recommended for people under 65, but we're learning that the National Advisory Committee on Immunisation is set to give an update on whether it should be used in seniors later this week. That recommendation was because of limited data for older populations, but they've been looking at some reviews and some studies out of Europe which suggest that it might be more effective in seniors than first thought. So we will be watching for that update at some point this week.
Of course, Quebec already going ahead and using it for seniors over 65. Regardless of the NACI recommendation. Laura, thank you very much.